2025 brings major changes in healthcare policies around the world, and senior migrants are among those most affected. For millions of older adults living abroad, access to affordable and reliable healthcare is not just a convenience, it's a necessity. In this video, we will explore the new healthcare rules introduced in 2025, how they impact senior migrants, and what steps they can take to protect their health and financial security. From eligibility changes to coverage limits and insurance requirements, this is a must-watch for anyone planning to retire abroad or already living as a senior migrant. Governments worldwide are introducing new healthcare rules in response to aging populations, rising costs, and budget pressures. Some of the key trends for 2025 include tighter eligibility rules. Many countries have revised the age or residency requirements to qualify for public healthcare benefits. Senior migrants may need to prove longer residency or higher contributions to access full coverage. Increased copayments and fees. Even if seniors remain eligible, copayments for consultations, medications, and hospital stays are rising. Some nations are also introducing annual healthcare service fees. Limited coverage for migrants. Certain treatments or services, previously fully covered, now require partial out-of-pocket payments. Migrants may not qualify for all government healthcare programs. Stricter documentation and verification. Seniors now must submit more paperwork to prove eligibility, including proof of income, residency, and prior healthcare contributions. Insurance requirements for new migrants. Some countries now mandate private insurance for senior migrants before allowing residency renewals or visa extensions. These changes reflect governments' attempts to balance healthcare sustainability while still providing essential services, but the result can be confusion, extra costs, and stress for senior migrants. For senior migrants, rising healthcare costs can significantly impact financial security. Increased out-of-pocket expenses, copayments, premiums, and medication costs are higher, stretching limited retirement savings. Private insurance premiums. Mandatory insurance for new migrants or gaps in public coverage can cost thousands of dollars per year. Unexpected medical bills. Seniors may face bills for treatments that were previously covered under older policies. Budget reallocation. Many seniors may have to cut spending on leisure, travel, or even basic necessities to cover healthcare. Imagine a retiree who moved abroad on a long-term visa. They were previously fully covered for hospital visits and medications. Under the 2025 rules, they may now pay hundreds of dollars for the same services. This creates stress, reduces quality of life, and can even delay necessary treatments. Financial strain is not the only consequence. Health outcomes can be affected if seniors avoid or delay treatment due to costs. Delayed consultations. Seniors may postpone doctor visits, leading to worsening chronic conditions like diabetes, hypertension, or heart disease. Reduced medication compliance. Higher copayments for essential drugs can cause seniors to skip doses. Mental health impact. Anxiety, stress, and depression may increase due to financial and healthcare insecurity. Access disparities. Senior migrants in rural areas or those without family support may struggle more than urban residents. Overall, these new rules have a direct link between financial and physical health, highlighting the importance of planning and preparation. Let's take a closer look at how different countries are implementing these 2025 healthcare changes. Australian new copayment requirements for senior migrants accessing Medicare. Some visa subclasses now require private health insurance before approval. Seniors with limited residency history may have restricted benefits. Canada provinces are updating coverage eligibility for non-permanent residents. Increased administrative verification is now mandatory for seniors over 65. Some treatments and dental services may require out-of-pocket payment. United Kingdom NHS rules now require certain migrant retirees to pay an immigration health surcharge annually. Certain specialised treatments have longer waiting times for non-UK nationals. European Union countries like Germany and France maintain strong public healthcare systems, but have introduced stricter insurance verification for senior migrants. Copayments for medications are slightly higher in 2025. United States Medicare eligibility still requires permanent residency and sufficient contributions. Private insurance is mandatory for many senior migrants not qualifying for Medicare. This comparison shows that while rules differ, the trend of rising costs and stricter eligibility is universal. What can senior migrants do to protect themselves under the new 2025 healthcare rules? Verify eligibility early, check residency and contribution requirements. Contact local health authorities to confirm coverage. Secure private insurance if needed, consider reputable insurance providers. And review policies for pre-existing condition coverage. Plan financially, budget for higher co-payments, medications, and potential emergencies. Maintain medical records, keep personal copies of all medical documents, prescriptions, and treatment history. Leverage community support. Local migrant associations and senior centers can provide guidance and assistance with healthcare paperwork. Stay informed. Government websites, newsletters, and official policy updates are essential sources to avoid surprises. By taking proactive steps, seniors can mitigate the impact of rising healthcare costs and maintain access to essential service. What does the future look like for senior migrants? Policy adjustments. Governments may refine rules in response to public feedback and migrant advocacy. Insurance innovations. Private insurers are likely to offer tailored senior migrant plans to cover gaps. Technology in healthcare. Telemedicine and digital health records may ease access but require digital literacy. Financial planning. Seniors may increasingly plan for overseas retirement with healthcare costs in mind. The key takeaway: staying informed and proactive is critical to navigating healthcare changes in 2025. Voice softens. Reflective music rises. New healthcare rules in 2025 are a reality for senior migrants. While the changes aim to manage costs and sustainability, they bring challenges for those who depend on healthcare abroad. For every senior migrant watching, the message is clear: plan early, stay informed, and seek guidance. By taking the right steps, you can safeguard your health, financial security, and peace of mind. If you found this video helpful, like, share, and subscribe for more updates on migration policies, healthcare changes, and senior welfare. And tell us in the comments, how are these healthcare changes affecting you or your family? Thank you for watching New Healthcare Rules in 2025 Impact on Senior Migrants.